I'd like to introduce John from the United States, who takes LDN for Manic Depression. Thank you for joining me, John.
Okay.
Could you
I'm
tell
glad
me...
to be with you.
Thank you very much. Could you tell me when you first heard about LDN?
I first heard about Low Dose Naltrexone in the first week of April of this year, 2013.
Mm-hmm. And how did you hear about it?
I have a dear friend who is an osteopathic physician, and I had been I had been in and out of severe mania and depression for a period of about 8 years, and she treated me. She gave me a series of osteopathic treatments over 2 weeks, and she recommended that the LDN, because LDN helps to produce a feeling of calm and deep relaxation and a sense of well-being, and that's she prescribed it to me for that reason, because I was experiencing a lot of anxiety. I was very uptight, unable to relax, was not sleeping well as I could have, and so she prescribed the LDN to me for those reasons.
Mm-hmm. So, talk us through it. What happened when you first started the LDN?
Well, when she was just starting it herself. This physician always uses herself as the test subject for any medication or protocol that she is going to prescribe to her patients. And she asked me if I would do it in conjunction with her. I was the first person that she prescribed the LDN to.
Mm-hmm.
We started off at a 3 milligram dose to be taken at bedtime. I took it at bedtime, and I would sleep for maybe an hour and a half, 2 hours, and wake up wide awake, and be up for 2 or 3 hours, and then go back to sleep. So on my own, I started taking it in the morning rather than at night. And after about a month, and I started, as I mentioned in the comment on Facebook, I had been experiencing, really deep to the bone pain in both of my thighs. The muscles, everything, all the way to the bone, just ached, and nothing I did relieved the pain. There might be some temporary relief, and by temporary I mean maybe 10 minutes from deep tissue massage. After taking the LDN for about 2 weeks, I noticed that I didn't have that pain in my thighs anymore. And taking it in the morning, I was able to sleep very well. And I was told that LDN releases endorphins. Is that what they're called?
Yes.
Aids in the release of endorphins during sleep cycle, so that you sleep deeper and wake up refreshed, and then you have an overall sense of well-being throughout the day. And that has been my experience since 2 weeks past when I first from 2 weeks from the beginning of my taking medication until today, that I have experienced no pain in my body at all, anywhere. No headaches, nothing. I never get headaches. I used to get headaches all the time. And I sleep very deeply, and I feel very good. I mean, I feel very relaxed, very at ease, a feeling of all is right with the world.
Mm-hmm.
Kind of thing. That is my experience in taking the LDN to this day.
Well, that's pretty amazing, isn't it? If you had to rate your quality of life on a score of 1 to 10 before LDN, what would it have been?
Before LDN?
Yes.
Oh, I would say a struggling 3.
And what would you say today?
25.
25 out of 10. Well, that's pretty amazing, isn't it? And it's only been, what, 6 months have you been taking it now?
No, let's see, April to May is 1 month, May to June is 2 months, June to July is 3, July to August is 4. Yeah, 6 months.
6 months, yeah.
Just about 6 months exactly.
Wow, that is an incredible story. And how would you say your manic depression has been?
It's gone.
Gone?
Yeah, well, I take medication for it.
Mm-hmm.
You know, but I take lithium. I take lithium and Seroquel as mood stabilizers. That's what they're called, to keep from going into mania.
Mm-hmm.
And I experience, usually with these medications there are strong side effects. I experience no side effects from them. I'm not, in my personal experience, my experiences of mania to the point of insanity have been such that I would never risk stopping taking the medications to find out whether or not I need them.
Mm-hmm.
But there are, I don't know if you want to speak only of LDN. If you only want to speak of LDN, that's fine. But there are other things that this physician prescribed to me that work in synergy with the LDN.
Yes, go ahead.
Well, she prescribed a regimen of what is called methylated B vitamins. Methylated vitamins are produced in such regular B vitamins or regular vitamins of any kind must be what's the word I'm looking for? They must be broken down to a primary condition before the body can absorb them, and as a result, through environment, through hereditary genetic DNA coding, and also due to the extremely poor condition of the soil and water supply around the world, our body is unable to fully break down B vitamins in particular as they are. Because it has to break. It has to kind of. This may not be fully accurate, but this is how I would describe it. There is a coating, or a series of layers on the vitamins in their manufacturer. That outer layer, you might call, has to be removed by the body before it can actually get to the assimilatable B vitamin itself. There have been, this has been recognized by science, and methylated forms of the vitamins are now being produced, and they're 100% assimilable by the body. And B vitamins are crucial in relaxation. They're crucial for overall well-being and maintenance of good, physical, mental, emotional, and psychological health. So those B vitamins, in conjunction with the LDN, I would say are the combined contributing factors for what you have expressed as an extremely remarkable turnaround, which it is.
That's truly amazing, John. Thank you very much for sharing your story with us.